Hi, my name is Jude Timber, and today I'm going to be talking about the influences of exercise and injury on childhood development. Regular physical activity is vital in developing a child's bone and muscle strength, and I will dive into why that is and how that happens. And there are 3 levels to it. It is similar to the Goldilocks and the 3 Bears story, where there is either too much, too little, or just right. A huge social aspect is associated with physical activity, play, or exercise. Playing in the playground with friends is a great way for a child to develop physical activity while also getting social interactions, which are vital for improving cognitive development. This is why exercise is important. The first of the 3 levels is the appropriate level. So this is the appropriate level. This is the level that is just right. In this level, a child is receiving an adequate ratio of exercise to recovery. At this level, the child will experience increased muscle mass, lean body mass, and bone mineralization. This is the ideal level of where a child needs to be at when they still get plenty of physical activity without causing damage to the bones or muscles. The second level is too little exercise. In America, this is the level that is probably the most common. Children are not getting enough exercise throughout the day, leading to more sedentary lifestyles. What this level does to the body is that it leads to significant decreases in body mass. It also increases the amount of fat mass and leads to a variety of risk factors such as developing high blood pressure, high cholesterol, and type 2 diabetes. The third level is too much exercise. Too much exercise is also something that we have to be wary of when looking at a child's level of activity. Too much, too fast is something that a lot of parents are not cognizant of when putting their child through 2 to 3 sports that play or practice every day. Too much exercise can lead to an increase in epiphyseal injuries. Epiphyseal injuries are injuries that affect the epiphyseal plates in your bone, which is responsible for bone growth and bone development. As I just mentioned, too much exercise can lead to growth plate damage. This can lead to stunted growth and be difficult to recover from. Lastly is the muscle and tissue injuries that are associated with too much exercise. Muscle tissues are not as detrimental as epiphyseal injuries. However, it should be something that we should be aware of when working with kids. On the left portrays this concept perfectly, where a child is getting the proper amount of physical activity to sleep to leisure time, which is very important. It leads to a healthier lifestyle later on in life and prevents various effects linked to obesity. The most important level to be in is the appropriate level. To reiterate, this is where the child gets enough rest and activity. The 2 levels that we should be conscious of are when a child is getting too much or too little exercise, because both can be detrimental to development. Thank you.